So welcome everyone to today's IVI Coffee and Talk. Thanks for coming along. And today we are going to hear from Dr. Marco Alfano, who is a researcher here in the IVI and who is the Digital Health Cluster Lead. So I'll hand over to you, Marco.
Thanks, Grace. And let me share my screen. And I start. Okay, thank you very much, Grace, and everybody for being here. And I will talk today about one of the activities that are doing as a digital health cluster in IVI, and it's a project that has been funded by LIRO and is on responsible use of AI for person empowerment on health and well-being. And the motivation of this project starts from the fact that we all know we are facing the technological innovation that of course are accelerating disruption in all fields, but in healthcare in particular. But there is still a disconnect between the present healthcare system that are more focusing on disease management, so kind of solving the specific diseases, and a more holistic approach where the objective is of empowered consumers, so people who participate in their health and well-being also are considered again from a complete point of view, and people have a direct participation. So two of the main fields that can help to have this new paradigm take place is on one end have patient empowerment or person empowerment, because I also like to consider a person before being a patient, because we're also talking about health and well-being, so that also about prevention. And so an empowered person and patient is someone who understands conditions and treatment and health information in general. He's not a doctor, but has a basic understanding of the health information, mainly for what is concerns him or her. That can decide, make informed choice, of course, together with healthcare professionals, and act self-managing his or her health. And AI, of course, artificial intelligence has a prominent role in healthcare. We have seen many applications with the virtual assistant, symptom checking, diagnosis, and etc. But I did a very preliminary research survey where I saw that the results were few applications really exist for person empowerment, and AI that empowers mainly machines rather than people. And I always make an example of the self-diagnosing tools that are very nice, are very powerful, but they are just replacing the human doctor with the machine doctor, so that they are not really empowering people, because you don't really understand what's going on. You just get a diagnosis. And virtual assistants that are mostly created for specific conditions and really, again, work as a silo, so not in a coherent and cooperative way. And the comprehension of health information is really seldom addressed and by virtual assistant. So that I come up with this idea of using a responsible AI for person empowerment. And the research question here is, how can a responsible AI be used for empowering people and help them better comprehend health information, make informed choice, and self-manage health and well-being? So the three main steps of the patient empowerment, again, of course, with healthcare professionals. And so if we look at the responsible use of AI in general, there are many documents, there are many papers, and this is becoming a very prominent topic. And by the way, when I use the term responsible AI, somehow is used interchangeably with trustworthy AI or ethical AI. I will show in this presentation, I consider this slightly different, but often you see them also responsible AI, trustworthy AI, or ethical AI used in the same way. And there are two main documents from the WHO, and that is about the ethics and governance of artificial intelligence for health, and the ethics guidelines for trustworthy from EU. And they are really making, considering what are the most important aspects of AI that still keep the human being at the center and keep and protect his autonomy. You see here, and this is taken from the WHO document, the protecting human autonomy is important, promoting human well-being and safety and public interest. And of course, you have transparency, explainability, and so on. But it is taken from there. The document says that AI systems should really empower human beings, allowing them to make informed decisions and fostering their fundamental rights. So the human cannot put aside and just let the machines to decide for us. We must be at the center. We must be always in the loop. We must make the final decision. So that, to me, not through responsible AI in health is possible without the direct intervention of empowered people, because it's important at this stage to understand if a person does not understand the algorithm and the outcome of an AI system, of course, will not have a possibility to really make a decision to control the outcome of the AI machine. So that is important that the person is empowered. And from this point of view, there is to me, this can work in an effective way by what I'm calling the virtuous circle. Because if we have a responsible AI system that provides a responsible output, can help this responsible AI system, it can facilitate a person empowerment by providing information that helps him or her to understand, really to understand and become empowered. At the same time, an empowered person can kind of feedback to the responsible AI system and can participate in an active way in the decision, understands the process, the output of the responsible AI system, and participate in the decisions and the actions of the system. So achieving a true, what I call a true responsible AI, because you cannot have a really responsible AI without the empowered and the active participation of the human being. And so at this point, personal empowerment becomes both a requisite and an outcome of responsible AI, because it's an outcome, but it's also a requisite, is an input for the responsible AI system. And so with this in mind, I went to understand more and to understand, okay, but how can we make this possible? How can we do this in practice? And so if we take, in this case, the other document, the EU ethics guidelines for trustworthy AI, first of all, we have 4 ethical principles that I consider them as a foundation, the document considers as a foundation, but is related to what I call responsible ethical AI. And there is a respect of human autonomy, prevention of harm, fairness, explicability. And this can become somehow translated, again in the document, I didn't add anything, just I've taken this from the ethics guidelines in 7 key requirements. And this is what I call here trustworthy AI, but this is again my point of view. And but this is more realization, so that the responsible something more and the ethical more in terms of principles, and the trustworthy AI more in terms of realization. And there are 7 key requirements: human agency and oversight, that are again the human role, technical robustness and safety, privacy and data governance, transparency, fairness, non-discrimination, fairness, and so on. And at this point, the next step is, okay, but how can we operationalize this? How can we measure what is the responsible AI in a system? And so that I came up with this list, translating and using these ethics guidelines. I came up with this list. It's just an example, so it's a draft. Don't consider this as a final list, but are terms that probably you already have heard many times when talking about or listening to talks about trustworthy, responsible AI. Accountability, actionability, accuracy, completeness, explainability, lawfulness, fairness, and privacy, and so on. And interestingly enough, from another study, from another research that I was doing on personal empowerment, I saw that I did a literature survey, and I saw that the main requirements for the health information seekers are language complexity, information quality, information classification, customization. And these three requirements can be translated somehow, can be mapped to the same examples, to the same characteristics that you see in this red-pink column. And of course, the characteristics that refer we see here in the for the system, are trustworthy AI system requirements and are more kind of technical requirements. So are requirements on the technical system, on the AI system. So how the AI system should behave in order to be responsible. And the characteristics that you see on the right are more social technical and are requirements on the information that helps a person to become empowered. So it's the same term, but is used in different contexts and for different reasons, even though they are quite connected, because as I showed before in the virtuous circle, so the responsible output, the responsible AI system provides a responsible output that empowers a person that in turn provides an empowered input to the responsible AI system. So that these two characteristics, and we have operationalized and we can measure, that will help us to create a real responsible AI system for a person empowerment. This is just the methodology, the process that should work and should be implemented. I will show in the next slide that we started to implement even just a very first prototype. But on the so that how this system, so if we want to create a conversational health agent for personal empowerment, how does this work? On the one hand, it will work on having the input from the user in terms of query about complaints, about diseases, and some tailoring criteria that are the health information about age, gender, current health status, background status, lifestyle information, etc. And then we will have the responsible AI algorithm that will apply this responsible AI using the characteristics that I showed before applied to the system. And then we'll retrieve health data and will customize the information using the criteria and the characteristics that I showed you before applied to the information. So for the person to become empowered. So do you see both characteristics are applied and can be measured. And this this system and will use external information from the web. Or of course, this is a system, as you see, a feedback, and so that it will learn is an intelligent system that will learn also from the user and will provide a more and more customized and tailored output. And so the user will provide an output with about information about complaints, diseases, tests, and information, in general information on the health, and also secondary output that the secondary scheme, is a coloring scheme with kind of a triage saying about the seriousness of the complaint, so that the patient who is telling the system that has a specific complaint maybe should run if it is red. I will show the next slide. Actually, I show immediately. So this is the prototype where you can just put age and sex, indicate what is your problem. You have a list of a complaint, indicate what is your complaint. In this case, for example, that is bleeding in mouth. There is a red background, can be red, can be yellow, can be green. Of course, red is very serious, so maybe you should go to the doctor right away or to the hospital. If it is yellow, okay, something to take into consideration quickly, but not so urgent, and green is something that, okay, you can take, but with some time. So this is, again, a very preliminary application, but we did a prototype so that at least we have something to show. And if you need more information, of course, please contact me. And just the next steps, and collaboration opportunities are on all I presented, so that I'm really open. I really would be you are very welcome to contact me to understand more, to participate, to collaborate, because for me is a very interesting, and I also want to share and to involve as many people as possible. So of course we have to understand the responsible AI and the human role, as I said before, analyze the connection between responsible AI and personal empowerment, determine the health data that are needed for creating, for example, about security, privacy issues. That is a very topical problem. Establish technical and socio-technical requirements. We saw in the response, I show the characteristics is an example, but of course to refine, create the responsible AI methodology, and implement and test. I show you that prototype is something, but of course it must be further developed, because it's at the preliminary stage. And of course this would be also, we can generalize the results, because we can provide indication for development of a system with what I call the true responsible behavior, where the human has an active role. So it's not to put aside from the machine, but really collaborate with the machine, human-machine collaboration, in order to get the best results. So I stop here, and if there are questions, you're very welcome to do that.
Thanks very much, Marco. So if anyone has any questions, comments, feedback for Marco.
Hi, it's sorry, I hope you don't mind me butting in, and I just realized my Zoom name is it's not my actual name, it's the company Zoom. So my name is Amanda Crean, and I work with GS1 Ireland. So we're the standards organization who'd be responsible for identifiers and, you know, the implementation of barcoding across healthcare. So I'm sorry I joined late, and you might have already covered it, but I just noticed just in your presentation that you're using say different disease classes or identifiers, and I'm just wondering, have you looked at say, like, for instance, like the ICD-10 codes, or using that in the breakdown of the diseases, and just to kind of make it more interoperable then for when it's looping back into the, say, the responsible AI, as you're calling it there, or the connection back with the healthcare provider?
Yes. Actually, we started with a list of diseases. We are working, of course, under with a collaboration with a medical doctor that is helping us, because I'm a computer scientist, so I'm not a medical expert. So that we are working with medical doctors. So we created that list. Let me show you this list, so that, for example, in the prototype, you see this is indicating a problem, and this is we are using a terminology that is, let's say, as close as possible. Of course, this is our intention, as close as possible to understanding of a user, a patient, a person who was not specific skills on health. And of course, then we have a list of compliance that we created, and we have mapped them in mainly to UMLS, because we wanted to use different vocabularies. You know, the Unified Medical Language System from the National Laboratory of Medicine of US, and is a meta-thesaurus that considers and contains all the vocabularies and all the also the ontologies and all the, so for example, ICD-9, ICD-10, but also MESH, also SNOMED, also others that, so we want, of course, to use, because it's a huge, enormous source of information, so that in order to provide more information, the only thing that we, because from another work, a previous work where we created a translator of medical terminology in layman terminology, in simple terminology for user. We want to be sure that people can really interact. People with any medical knowledge can really interact. So we for sure we are using these vocabularies because we want to, again, we want to connect, link the information, but at the same time we want to be to use easy terminology so that people can interact. So that is a little bit of both.
Yeah, no, thank you very much. No, it looks very interesting. Thanks.
Thanks. And for sure, again, if you want to know more, just drop me an email.
Of course,
I can provide you some more information. You're welcome.
No, I noticed these coffee talks on LinkedIn, so I just think it's a really good idea. So thank you for organizing it. It's nice to hear about research going on in digital health. So thank you.
Yes. No, you're very welcome.
Thank you.
So there is, I think, a question from actually two. Olusegun.
Good afternoon.
Yeah, hello.
Can you hear me?
Yep.
Okay. I just wanted to clarify, in your presentation, you were trying to demarcate between responsible. Sorry, I'm Olusegun. I'm a PhD student in the School of Business. My research is actually on trustworthy automated decision-making systems. So I'm quite interested in, AI-related issues. So you're trying to separate between responsible AI and trustworthy AI. Why do you do that? Why is that?
No, not really. I consider them actually together. It's just a term. It's just not a matter of terminology. So it's not that I want to separate. It's just that for, let's say, sake of discussion, I consider responsible more or ethical a more abstract concept, and trustworthy something that somehow, if you operationalize that, you can measure. But again, it's my point of view. I said at the beginning of the talk, they are used interchangeably. So they to me, we can use interchangeably. I saw this. I was reading this document from you, these guidelines from you about trustworthy AI, and I was just using that. This one, and because they were talking about 4 ethical principles and 7 key requirements, so but they are talking about the guidelines for trustworthy AI. So that this is my interpretation, that the foundations, the responsible AI, ethical AI is something more kind of based on principles, and the realizations is more trustworthy. But again, it's my point of view. You can use interchangeably. The discussion is remains exactly the same. I hope it. I answered your. Yeah.
Thank you.
Okay. Thanks. Mansoor, you're on mute.
Okay. Can you hear me now?
Yep.
Okay. So thank you, Marco, for the interesting presentation. I was just curious about 2 things. The first, well, definitely wherever the health data is part of any system, so the security and privacy of the system is, it has to be there. Without this, you cannot go ahead with providing such a system to the end user. So what do you think regarding the security and privacy? Are you talking about the client side security and privacy kind of a thing, or the server side, which you are considering? And the second thing is regarding the standardization. You talked about using the ontologies as well, because there are so many other terminologies which exist in the medical domain. So which ontologies, did you happen to have a look on the OBO Foundry or NCBO ontologies, which are quite comprehensive and standard ontologies for the medical domain?
Yes. So, to the second question, when I talk the UMLS and the concept unique identifier, I'm talking the meta thesaurus that contains all the ontologies, so that the ontologies that you're mentioning, and this is why I want to keep it a generic one, because I want to try to use as much as information as possible. So I'm considering them, and this is why I'm using this concept unique identifier so that I can connect to the different ontologies. To the first question, of course, privacy and security is very important. And I'm here. Okay, probably I don't know if you can read. And again, this considered just as an example, not but I'm considering privacy from, for example, the system point of view. I say that the requirement is the extent to which privacy and data protection in a system processes of data collection and data processing is assured. So you ensure the privacy and the security are the privacy and data protection at the system level. But there is also a requirement at the user point of view, the information point of view, is to the extent to which a user is in charge of his or her sensible information can decide with whom to share it and to what extent. So it's the user who is, many times said that the user who owns the data is also empowered because he's owning the data. It's not enough, because if you don't understand your data, you cannot decide to whom to share with the data. And so that whom you to share with, and so that is important that you really have an understanding. But privacy is also that you have your own data and decide, okay, you should share with the data, but understanding them. And on the system point of view is about complying with the rules, GPRS and etc. about data protection and the privacy.
Okay. All right. Thank you.
Welcome. Priyanka.
Yeah, hi, Marco. Thank you very much for your presentation. Indeed, a very interesting work. I had a question regarding the characteristic about lawfulness. So I was just wondering, how are you get the data about the existing laws and regulations? I mean, are you fetching this information from already publicly available like databases, or if there is any other source from where you can like verify that system is in line with the existing laws?
Yes. Again, yes. The problem there are here twofold. First of all, there are not really many laws, regulation about the responsible or trustworthy AI behavior. So that is mainly the fact that, for example, that although we are talking about the privacy, but of course lawfulness is about the AI system that complies with the GDPR, sorry. So that is, on this case, is more following guidelines, because one of the problem is that we don't, so far, of course, these things are changing, and trustworthy AI, responsible AI has been at the center of the discussion in the last months, in the last year for sure. And so that the EU is doing also something about the regulation. But so far, from my understanding, is that we have mainly guidelines, so that all the laws and regulations in terms of safety, because we also have many regulations about when we talk about the healthcare sector. So the system, in any case, has to comply with all the healthcare, let's say, regulation. The regulation applied to the healthcare sector and to the healthcare system or devices. For example, if it is considered, for example, a medical device, there are specific regulations. About the trustworthy AI is something, is more right now, is more about the guidelines. So in any case, the system must, because if it has to behave in a responsible way, for sure it has to comply with the regulations.
Okay, so you already like implemented those guidelines in the algorithms you are using for building the system?
No, yeah, not yet, okay, not in the system. I haven't, no, is consider again, this is just the preliminary work, and the prototype doesn't have this implemented yet. No, it's something that I have to do.
Okay, thanks very much, Marco.
Welcome. Any other question? Because I think we are already at 3.
Yeah, we're at 2 now, so we'll wrap up. But
so we are 3, yeah. We are 3.
As Marco said, if anyone has any more questions, feel free to reach out to him. I'm sure you're happy to answer any more, Marco.
Yes.
And thanks again for a really interesting presentation and a great discussion as well. So just as a reminder, I'll just share these are the various ways to keep in touch and keep informed about our events. And later on this afternoon, we'll be having a webinar centering around enterprise architecture and its role within designing digital transformation. So thanks again, Marco, and thanks everyone for coming along today.